persons with disabilities living in humanitarian context during the pandemic, and we're going to learn how they were included in the pandemic response. Before starting our fantastic round of speakers, I need to give you a few remarks about the event. First of all, this event is interpreted into Arabic and Spanish live. So even if you're speaking English, please make sure to go to the interpretation part of your screen and choose English language, because otherwise when colleagues are presenting in Spanish or Arabic, you're not going to be able to hear the English language interpretation. So make sure to choose the English, Spanish, or Arabic We still don't have
COVID-19 response, persons with disabilities.
Sorry. Can you make sure that they are muted?
Hello, all the time I'm doing mute for the people who are not talking.
And they are again unmuting themselves.
Correct.
All right, no problem. And then we also have international sign interpretation for the event that you can see on the screen. And we do have live captioning available. You can access the captioning in the link that is shared in the chat box. If you face any technical issues accessing any of these services, please feel free to post in the chat box. Thank you again for joining us. So without further ado, I want to invite Their Excellency, Ambassador Mitch Fiesel, the permanent representative of the Australian government in the United Nations in New York.
Australia better, Ambassador.
Australia in the ONU in
Nueva York. Waiting room for now. Yeah, I'm sorry, colleagues, about this inconvenience. So I want to invite Their Excellency, Ambassador Mitch Fiesel, to provide opening remarks, please. Your Excellency, floor is yours.
Well, thank you so much, Elam, and great to see so many colleagues called this morning. This is a wonderful occasion for us to gather, to share notes, and to listen to each other's experience and understanding. And can I firstly thank the co-sponsors of today's event, and in particular, the Disability Reference Group, and also colleagues from Germany for facilitating this important discussion. Well, friends, taking an inclusive approach to humanitarian action really will help ensure our pledge to leave no one behind, to make sure that it is more than just an aspiration. Pre-existing inequalities do tend to be exacerbated in time of crisis, and this is particularly true of people with disabilities, and even more so in the current pandemic context. Effective humanitarian action has to ensure different groups are included in decision making, and also in the design and the delivery of the activities, rather than having decisions made on their behalf. It really is important that COVID responses consider the unique needs, the priorities, the capacities of different groups, especially women and girls with disabilities, in all aspects of preparedness, response and recovery. It's something that we know well, that partnerships and collaborations with such groups really do improve the effectiveness and the accountability of humanitarian action. In that spirit, we very much welcome the establishment of...
Hello, can you hear me?
...last year, and the activities that it's undertaken to date, which have already made a really valuable contribution. And we've been hugely impressed, I've got to say, with how the DRG has been able to gather such a large and diverse group of members, and how quickly it's been able to build its work plan. For our part, Australia, we're pleased to be in the process of putting in place new funding support for the DRG to ensure that it is well resourced to carry out its extremely important work. Again, for my own country of Australia, I really want to make clear that disability inclusion is not an add-on. It's not a nice to have in humanitarian action. It should be at its heart. And this applies to the COVID response as well. We know that the needs are unprecedented, but this message has not changed. In fact, the pandemic has thrown up issues that make it even more essential to focus on strengthening disability inclusion in humanitarian action. And we're hearing more and more that there is a growing recognition of the need to promote disability inclusion in humanitarian action, and that important steps, fortunately, have been taken. But these efforts do need to be more concerted. They do need to be more systematic, including from states and donors. And what we especially need is to transfer the global frameworks, tools and plans developed over the past few years to the country and to the program level. The work streams of the DRG are clearly key to achieving this goal, and Australia stands ready to support. This is a great opportunity. I'm very pleased to be part of it, and looking forward to hearing today's discussion and taking very careful note of the challenges, a very careful note of the lived experiences, the best practices and the recommendations that will come out of today. So thanks indeed, and looking forward to a terrific discussion.
Thank you very much, Their Excellency, for your remarks. It's just reminding us of the importance and significance of the work that we are having ahead of us, especially during the pandemic. It has been even more. I want to express our gratitude on behalf of the reference group on inclusion of persons with disabilities in humanitarian action to the Australian government, who has been a great support for the group since the birth of the group, and also have been very generous to provide secretariat support to the group, started a few weeks ago, so that we can better serve our purposes. I also want to recognize that this event has been possible with financial support and contribution of the Leave No One Behind project, sponsored by the Federation of Foreign Affairs of the Germany, FFO. All expenses are covered by them, and the colleagues from the Humanitarian Inclusion have been kindly coordinating that. So it's all special thanks on behalf of the reference group goes to all of them. So now we are going to move to the first section of our content conversation, which is about the overall response at the United Nations level to the pandemic. When the pandemic hit, everybody was kind of surprised, especially those who were working in humanitarian context, which is already emergency situation going on. So we are going to hear from a few speakers about what has been taken, measures have been taken to address inclusion of persons with disabilities living in humanitarian contexts. UNICEF,
ننتقل إلى زميلنا من يونيسف.
Speak about the key messages that we have developed in the reference group with the support of the Interagency Standing Committee on how to include persons with disabilities living in humanitarian context in COVID-19 response. Kirsten, thank you so much, and floor is yours.
Thank you very much, Ilham. Great to be with you all today. As Ilham mentioned, my name is Kirsten from UNICEF, and I am co-chair of the reference group on inclusion of persons with disabilities in humanitarian action. The reference group, as many of you will know, was launched at Humanitarian Networks and Partnerships Week in February 2020, which also coincided with the very beginning of the global pandemic. So what I'm going to speak about just very briefly today for 5 minutes is about the key messages that we developed as the reference group at the start of the pandemic to guide disability inclusion in the response. Can I just ask everybody to mute their microphones? Thank you. So at the start of the pandemic, when the reference group had just been established, we established a dedicated working group on disability inclusive COVID-19 response. And one of the first actions of this group was to develop some key messages on applying the IASC guidelines on inclusion of persons with disabilities to the COVID-19 response. This document was very much developed by that dedicated working group, but it also had input from the broader reference group membership, and it was developed jointly with IASC Results Group on Accountability and Inclusion. The document was then endorsed by IASC principals and became an IASC document. Now, this document addresses the very specific considerations for applying the IASC guidelines in a public health emergency. And as with the IASC guidelines on inclusion of persons with disabilities, participation by persons with disabilities was very much highlighted throughout as a key priority action. The document is now available in French, Arabic and English on the website, which I will share with you in just a moment, so you can all access it there. Now, the document sets out both addressing the health impacts of the pandemic as well as addressing the socio-economic impacts of the pandemic. So what I have on the slide here is on the right-hand side, we set out how the health impacts of the crisis for everybody were exacerbated for persons with disabilities by a multitude of barriers, including environmental barriers, attitudinal barriers, and institutional barriers, which then resulted in persons with disabilities facing heightened risk and also facing very specific risk. The document then sets out the specific actions that can be taken to mitigate those risks. So for example, in relation to the health impacts, the document sets out actions such as ensuring accessibility of wash facilities, providing information about COVID-19 prevention in accessible formats, ensuring access to PPE that is appropriate for different impairment types, disaggregation of surveillance data by sex, age, and disability, etc. Now, these are also recommendations that were set out in different guidance documents on a disability inclusive response. But the difference with this document was that it focused in very specifically on humanitarian contexts and made some recommendations that were very specific to those unique challenges in those contexts. The second part of the document addresses socio-economic impacts of the crisis. So it again included that table that you saw previously, which highlighted how the socio-economic impacts of the crisis for everybody were really exacerbated for persons with disabilities due to the existence of multiple barriers, which again resulted in very specific risks for persons with disabilities. The document then sets out the specific actions to be undertaken in humanitarian context to address those socio-economic impacts. I've really just summarised them in a very, very shortened form here to give a sense of what some of those actions were. But they were, for example, ensuring that remote distance learning and return to school programs were inclusive of children with disabilities. And of course, the additional challenges around this in emergency contexts, in contexts that already are experiencing humanitarian emergencies. Also ensuring that GBV, prevention and response services, as well as mental health and psychosocial interventions need to be inclusive of all persons with disabilities. As well as addressing the barriers that persons with disabilities may face in the context of increasing reliance on technology for remote service delivery. So as we're all aware now, in the context of disruptions to services and movement restrictions, many areas of service provision, including health, education, and other services, switched to a remote online format, which presented multiple barriers for persons with disabilities. So there were also recommendations around this that are applied in a humanitarian context. Now, this is the note that we developed very early on in the pandemic. What we're going to be hearing about for the rest of today is what different actors have actually done to implement these recommendations and to implement an inclusive response in humanitarian contexts. So I'm going to leave it there. I'm going to put a link to this document in the chat so you can all have a look at that document yourselves, and I will hand back to Elham to take us through the remainder of the session. Thanks, Elham.
Thank you very much, Kirsten. Very helpful, and I encourage colleagues to have a look at that document and do get in touch if you have any questions about it. So when the pandemic hit, also the United Nations Disability Inclusion Strategy team established a few work streams to address the situation, and one of them was the working group work stream on humanitarian. So I want to invite our colleague and friend Isabel de Meister from the Office of Coordinating Humanitarian Affairs, OCHA, and also the Secretariat Support to the Interagency Standing Committee to brief us about the measures taken on that working group and also the document that they have prepared, summarizing some of the good practices on inclusion of persons with disabilities in humanitarian context during the pandemic. Isabel, welcome, floor is yours.
Thank you, Elham. Can you hear me?
Yes.
Yes, thank you. Hello, colleagues. Greetings from Geneva. I'm Isabelle de Musa, and I'm OCHA's Disability Inclusion Focal Point. I'm one of those who contributed in 2016 at the time of the WHS, the World Humanitarian Summit, to get the issues of persons with disabilities onto the humanitarian agenda, and I have been championing these since then. So as you may remember, one of the first policy briefs that the United Nations Secretary General released at the onset of the pandemic was about a disability inclusive response to the COVID-19. It emphasized how essential it is to ensure that disability inclusion is mainstreamed in all response and recovery actions, but also that commitment and creativity are required to put in place specific actions for addressing the challenges and barriers faced by persons with disabilities in the COVID-19 response. In order to translate these recommendations into concrete actions, 4 interagency working groups were created under the auspices of the United Nations Disability Inclusion Strategy, or UNDIS. One of these groups focused specifically on the COVID-19 humanitarian response and recovery, as Elham just mentioned. Kirsten from UNICEF, that you heard a few minutes ago, and I co-led this group, which consisted of 11 UN entities. One of the outcomes of our work that I will now like to present is a compilation of examples of good practices for including persons with disabilities in the COVID-19 humanitarian response. You can see the cover page now here on the slide. Before I go into more details, I would first like to stress that in no way we intended to be exhaustive nor prescriptive. The idea was that by sharing some insight into who was doing what where, and by presenting projects that are easily replicable, this could encourage other disability inclusive initiatives. Next slide, please. The examples listed in the document span over a wide range of topics, of organizations, and of countries. We organized them around the 9 basic themes that you can see now here on this slide, and that I will quickly list for those who wouldn't be able to read them. So engaging with OPDs, meeting basic needs, improving access to education, providing inclusive mental health and psychosocial support, ensuring inclusive risk communication and community engagement, innovation for inclusion, protection of rights, providing guidance to humanitarian actors, and monitoring an inclusive response. Each of these topics contains 2 or 3 examples of different approaches. For example, concerning the topic of education, the document describes how UNICEF ensured learning continuity for children with disabilities in Jordan, how UNRWA, the Relief and Works Agency, strengthened inclusion through digital platforms, and how the Office of the High Commissioner of Human Rights supported local actors in Guatemala. Because of time constraints, it is impossible for me to walk you through all the interesting examples that we documented, but I will put the link to the document in the chat, and I would really encourage you to have a look at it after this event. In total, the report provides insight into some 30 projects. there is none which is more important than the others. By this, I mean that in order to ensure disability inclusive response, many aspects have to be taken into account, and many of these aspects are interconnected. Let me finish by mentioning some key lessons learned illustrated by the examples in the document. First of all, how important it is to have partnerships in place with organizations of persons with disabilities. Most of the partnerships and approaches mentioned already existed before the pandemic and offered a good working basis to integrate the additional needs and also to advocate with local or national authorities in the context of COVID-19 restrictions. Secondly, the document outlines how to consult persons with disabilities and their representative organizations whenever we assess needs. Assessment processes are essential to understanding the impacts of the COVID-19 on persons with disabilities. Of course, they have to be complemented with adapted programming, such as home delivery of assistance or adjusting social protection and cash transfer programs. Thirdly and lastly, the pandemic has shown the crucial importance of accessibility, both in terms of information and of service delivery, especially when the latter are remote, as in the case of digital platforms. They need to be accessible to all. The pandemic has also offered an opportunity to strengthen communication with communities, for example, by engaging them, including persons with disabilities, in communicating key messages, or by diversifying channels of communications. I will stop here, but I would really like to encourage you to make the best use of this document to continue or to improve a disability inclusive response to the COVID-19 pandemic. Thank you for your attention.
Thank you very much, Isabel. Very interesting document with good lessons. One of the lessons was actually about partnerships, which beautifully connects us to our next speaker, our colleague and friend, John Vangwa from the United Disabled Persons of Kenya, who will tell us about their response to the pandemic in Kenya and what an interesting, innovative measure that they have taken. Welcome, John. The floor is yours.
Thank you a lot, and hello, colleagues. As mentioned, my name is John Wambua from United Disabled Persons of Kenya. Very briefly, I will talk about some of the tools that we were able to develop as a OPDs, Organization of Persons with Disability, both in Kenya and in Bangladesh, working under I project, that is Inclusion to Innovation project. The tool or the resource I'm talking about, we refer to as the Disability and COVID-19 Influencer Pack. So the Disability and COVID-19 Influencer Pack was developed in 2020 by persons with disability organizations working under I2I project after request also from the DPOs to address the increase in urgent COVID-19 situation. The back or the guide, the book aims to guide decisions affecting the lives of persons with disability during and even after the pandemic. It explores the impact of the pandemic and the measures put in place to control the spread of the COVID-19 on persons with disability. The information presented shows the challenges faced by persons with disabilities and ways to influence change in attitude, change in behavior, and even change in policy that would make the response and the recovery efforts more inclusive during emergency situations like COVID-19, and are all in line with the UN Convention on the Rights of Persons with Disability. Some of the challenges that we were able to capture on the influencer part faced by persons with disability in the pandemic included the lack of access to information and communication, exclusion in decision-making processes, as the authorities develop responses to mechanisms to COVID-19, lack of access to essential services, lack of targeted support, as well as loss of economic independence by persons with disability. This was occasioned by reduced economic opportunities. The influencer pack was produced mainly as a guide to anyone or any organization or any person with disability who want to influence decisions, to influence change in attitudes, to influence change in behaviors or policy, which could make the pandemic preparedness, response, and the recovery for more inclusive for persons with disability. But it is not limited to COVID-19 situation only. It can be used in other humanitarian situations because many of the principles in the influencer pack are applicable in other contexts. The influencer pack was developed through participation and meaningful involvement of the DPOs, as I mentioned, in Kenya and Bangladesh. The final version of the pack is available in accessible PDF document. The influencer pack contains thematic resources, including topics on inclusion in decision making, gathering and using disaggregated data, accessible information and communication, employment and economic independence, among others. These resources can be used to develop advocacy strategies that could influence change. Each influencer resource can be used independently to help specific advocacy action, or it can be used together for the larger strategy. For the largest strategy. The DPOs, as DPOs, we have used the resources in the influencer pack to gather disability data and to develop data-driven advocacy strategies, both in Kenya and in Bangladesh. Some of the strategies included activities such as engaging the government to ensure COVID-19 responses and the recovery plans were inclusive to persons with disabilities. We advocate to ensure that information regarding COVID-19 measures and other relevant information is accessible to persons with disabilities. We also engaged as DPOs, we also engaged youth bearers, and this is based on the information we gained now from the influencer pack. We engaged the bearers to ensure social protection measures are inclusive to persons with disability. We also engage the employers regarding employment of persons with disability. And also based on the lessons from the influencer pack, we have held forums and also and workshops to raise awareness and sensitize youth bearers and the public on the rights of persons with disability in the humanitarian situation. I will make sure to share the link to the influencer pack. From that point, I think I'm through. Thank you.
Thank you very much, John, for your presentation. It was interesting to learn about it. From my sound, your sound was a little bit at some points breaking, but still interesting presentation. Thank you so much for that. So from Kenya, we're going to go to Nepal and hear from Mr. Mitra Lal Sharma from the NFDN, Nepal, National Organization of Persons with Disabilities. He's going to provide his presentation in Nepalese. So it is important that you choose English as the main language of the event so that you can hear the translation. Floor is yours. Welcome to the meeting and thank you so much for joining us.
Thank you. Respected all dignitaries, warm greetings and namaste from Nepal on behalf of National Federation of Disabled Nepal. It is an umbrella organization of the DPO. Thank you very much for providing this platform to share our important experiences. Thank you so much to the organizer. Due to the COVID-19 pandemic, whole world is very much affected and Nepal is also not free from it. And context to Nepal, people with disabilities are very much affected from the COVID pandemics and number of people with disabilities are being infected. Not only that, various socio-economic impact are also huge. As a result, persons with disabilities are very much backwarded. This is very much shown by the various research. Before the first wave of COVID pandemic, those with the realization of that many persons with disability might be severely impacted. With that assumption, we had started working immediately, especially for the support to avoid the discrimination and adopt the non-discrimination policies. So we wanted to ensure this accessibility in terms of service delivery and information, for which we have issued a general guideline that is applicable to all DPO and other stakeholders. And right after that, we had to face the lockdown, where the impact assessment was done, and the findings shows that people with disabilities has lost their regular income, their regular service on health and assistive devices were interrupted. They were faced various mental trauma and stress, and also faced discrimination, abuse, and violence and harassment. So these were the findings from our research. Based on those facts and findings, we had initiated various advocacy work, and we have mobilized various OPDs in all level, federal, provincial, and local level, to do the public advocacy. And with the support of CVM Global, we have initiated a project in 2 different, severely districts in 4 municipalities from 2 affected districts. And that was a short period of project, but it was, started and done in a consortium model, where we have provided the support from the different organizations, like a CMC, that is the expert organization in psychosocial counseling, whereas another organization called SAPROS, who was working in livelihood. So we have initiated these programs along with the DPOs as well as with the other expert organization. We have provided various livelihood support, data generation, segregated data, local advocacy with the local government, and also preparing various COVID response programs and plans, and partnering with other organizations who are working not necessarily for the disability, but we initiated for the disability inclusion. We have provided several accessible information by OPTs as well as with those expert organizations in psychosocial counseling as well as livelihood support. Whereas CMC was expertise in psychosocial counseling, and SAPROS was focusing on various kit distribution and relief distribution. People with and without disabilities, but who are very much vulnerable from socio-economic aspects, were provided support. And we have also worked in a grassroots level for the COVID response. We have held and initiated various stakeholder workshops, and we have formulated a inclusive COVID response team where people with and without disabilities were benefited from these initiatives. In a national level also, we have run various IEC materials. We have developed various infographics, audio visual messages, sign language messages on sign language. So this initiative was highly appreciated by the government of Nepal, even from UN agencies. Since this was very innovative approach, other UN agencies and government of Nepal later on adopted this. Besides that, we have also provide our consultation in the government's policy and programs. Even not only in the government, but also our presence was highly made in the UN cluster system to raise our voices. We have worked in a consortium models, and though it was a bit challenging, but due to the mutual cooperation, we strongly realized, and it was our learnings, that multi-sector cooperation was very much important, and virtual learning was also very much important learning for us, because people with disability are not only in the form of beneficiaries but also an important contributor. That was very much proven from our initiatives. And people with disabilities and also the local people who need to ensure the reasonable accommodation in a local level was a strong realization. To deal with the pandemics, the preparedness is very important, and also for both preparedness and response, our mechanisms should be more activated and placed in a ready position, for which the capacity building of the non-disability sector is very much strong realization, for which stakeholders working in DRR, local agencies, partner organizations, cooperation and collaboration is very much important. Finally, before I end, due to the second wave of COVID pandemic, people with disabilities are very much dealing with this pandemic. And now our major focus is focusing on the priority for the COVID vaccine for people with disability. Just for the basic livelihood, relief support, employment program is very much important, and the public advocacy are still continued. But finally, the COVID vaccine priority for people with disability is very much important. Finally, before I take so much time, once again, thank you so much for giving this opportunity to share my opinion in this wonderful platform. Thank you. Thank you.
Thank you very much for your presentation. It was great to hear about the great experience you have had in Nepal, and we hope that we wish you best of luck for the future advocacy and measures that you are planning to take. So here I'm going to close this section and hand over to my colleague Christian Medino, the other co-chair of the reference group, to take us to the next section. Thank you so much, Christian.
Thank you very much, Elham. Hello, everyone. I hope you can all hear me well. So as Elham said, I'm Christian Medino. I'm one of the co-chairs of the Disability Reference Group, and I'll be moderating now the second part of this event. So after this great insight from Kestin, Isabel, John, and Mitra, we are now moving to the section where we will hear a bit more about good practices, but also challenges to the inclusion of persons with disabilities in the COVID-19 response. So for this, I'd like to welcome our panel discussion. And we have today with us Ricardo Placordero, which is Project Officer from UNHCR, Cien Andres, Disability Specialist from Humanitarian Inclusion, and Gabriel Soto, the Director of RIADIS, which is the Latin American Network of Non-Governmental Organizations of Persons with Disabilities and their families. Before doing so, however, I'd like to invite first Narim Omar Mohammed to share an open message with us all. Narim is currently a displaced person with a disability from Syria. So Narim will make his statement in Arabic, so please make sure that you select the interpretation channel on your Zoom, so that you can understand. So on that note, Narim, the floor is yours.
أنا ناريمان عمر محمد ولدت في راس العين.
أنا ناريمان عمر محمد. I am Nariman Muhammad. I had paralysis and I am now recovered. I'm able through my childhood and youth to overcome difficulties. There are initiatives. I went to Qamishli due to conflict, armed conflict. I have poverty. I am very poor. I suffer lots of lack of food items. We were deported. We were displaced. And when with COVID-19 started also, we took some measures as precautionary measures. However, these procedures had impact on the income. We had less income, which played a more role in this pandemic, and we had more cases of corona. Nobody cared about us, and it was difficult to access water, to reach water, in addition to lots of many people living in one place, in one tent. I followed all the medical health issues in Syria. We were all in one place. That was difficult. I followed all the instructions to help my community. There was not enough drinking water. I followed all the instructions to help my community. We needed more awareness about COVID-19 to protect ourselves and others through courses and seminars, international organizations and NGOs, and granting organizations should provide more care, health care, particularly to the people with disabilities, to the disabled. I really care about inclusive of all services that we provide to people with disabilities, and providing them with food and money, water, and other needs, and not to be marginalized. And we need an income that will help us to continue our life with integrity. We, the disabled, have no opportunities to work, or even less opportunities, particularly through the pandemic, where many people lost their income sources. And this is also, this applies also to the displaced, those who were displaced and left their places of residence, and they lost everything. And those displaced also, it was worse for those who are also displaced and disabled with disabilities. I was able to overcome lots of barriers through organization and through raising awareness, and to protect myself and my family against COVID-19. 2019. People with disabilities, with special needs, were threatened by this COVID-19 due to the limited health services provided, and healthcare was less during the pandemic. Also, PCR tests were little, very few. With regard to vaccination, priority was given to other people, not to the disabled or people with disability, particularly for those who are working in the health care. People with disabilities have not been given any vaccination yet. The disabled need to be provided with health care. All organizations, international, regional, and local, should support people with disabilities and to protect them against the dangers, and to raise awareness in the camps and where they are displaced. Thank you very much indeed.
Great, thank you very much, Narim, for these powerful words. I think it's again one big reminder to us all of the big impact that COVID-19 is having on displaced persons, particularly, in conflict settings. So COVID-19 being a crisis within a crisis, and how it can impact persons with disabilities, and the need for us all to really put disability inclusion at the forefront of our interventions. Thank you very much, Narim, for being with us today. So on that note, we are moving now to our panel discussion. And I will be asking two questions to our panel, and starting with, what do we know about the impact of COVID-19 on displaced persons with disabilities and measures taken to protect them? So can I hand over then to maybe Ricardo for you to start with, and then we'll hear from the other two. Thank you.
Thank you. Thank you, Christine. And I would like to share 4 main areas of concern that UNHCR has been documenting in the last year. First, as highlighted by Narim, war and conflict continued despite the pandemic. Targeted violence, discrimination on the basis of disabilities were still consistently reported by our operations, and they are still among the root causes for forced displacement. Second, once forced to flee, persons with disabilities continue to face barriers to access not only COVID-19 services, but registration, international protection, asylum procedures that may be key, as well as interim processes, not only for their own protection, but as well to the protection against the pandemic, as we will discuss it later on the point of vaccination as well. The second and the third point is that the gap that was reported between needs of reported by persons with disabilities and service provision increased during 2019. Almost all operations reported this increase between the service provision and the disruption of services, and in particular livelihoods, as has been pointed, access to food and opportunities for income generation, and how the digital, the strong impact that a world that passed from live in the street to live or live online had in persons with disabilities. In terms of promising practices, well, what I can say is that to the best possible state, to best level possible, UNHCR teams stayed and delivered, as it was asked by the UN Secretary General. And I would like to share some figures, even if they are small, even if they may sound little, but as well for the accountability and the transparency that I think all UN agencies, but as well governments, NGOs should have towards persons with disabilities. For what we can see up to last year, around 55,000 women and men with disabilities were reached out by UNHCR and partners, and around approximately 8,000 girls and boys with disabilities. Services included direct cash assistance, food distribution during lockdowns, but as well conducting targeted visits when those were required because access to digital support was not efficient or was impossible. For them, there was a completely disconnect from some of the families that were covered or households that were covered by UNHCR, and as well support in education with remote access, WhatsApp groups, etc. Just to close with the role of organizations of persons with disabilities was key, and as it has been highlighted by Isabel, where those partnerships existed before, it was easier. So I encourage all colleagues in the field to build partnership with organizations of persons with disabilities. And we could see that in Ecuador, in Kenya. I will share some good practices, and I'm sure Gabriel will share as well with you. Thank you.
Great, excellent. Thank you very much, Ricardo, for these insights from UNHCR side. I forgot to mention, we will have a Q&A later on after the panel discussion. So if any of you have specific questions, please feel free to drop them on the chat box, or either ask the questions directly later on. Thank you, Ricardo. So let's move us on to maybe humanitarian inclusion. Xian, over to you.
Yeah, thank you, Christian, and hello to all online. So I'm going to briefly complete actually to what Nareem and Ricardo already highlighted, which has been very relevant for the findings we have as well as an organization. So actually in all of the countries we operate, we see a significant impact on persons with disabilities and their families. Many times due to initially mentioned public restrictions, the closure of borders, the changes in aid provision, around the displacement settings without any particular adaptations for persons with disabilities. And we see a particularly high impact of negative perceptions, both from humanitarian workers, families and communities towards persons with disabilities in the specific situation. For example, in most of the settings, we have reports and anecdotal evidence, often of high levels of violence and stigma, like earlier mentioned. And persons with disabilities reporting limited solutions or reasonable accommodation options to access registrations, distributions of protection kits, or to participate equally into the risk education sessions and access the information they need. So often our reports show that pre-existing lack of registration of persons with disabilities leads to limited targeting within the current response. And as well, their lack of meaningful engagement into, for example, camp representative structures leads to their ongoing exclusion from the current COVID response and engagement to actually adapt the COVID response. It's also important to highlight that particularly the institutional and attitudinal barriers, for example, the assumption that disability inclusion is not a priority within this COVID response where everybody is at high risk, they really aggravate the situation and access to assistance. So when it comes to health and well-being of persons with disabilities, we see a specific impact of change in rehabilitation care services as well, with the closure of services, the absence of staff, but as well the lack of protective materials. So also showcasing some of the older figures where we see in Myanmar that access to education for persons with disabilities dropped even down to 7%, or in Lebanon where access to regular rehabilitation care dropped from 34 to 11%. And of course, all of this is contributing to further isolation, economic challenges, and impact on psychosocial well-being of persons with disabilities. So from last year data, just to give one example, we saw in Myanmar that up to 70% of persons with disabilities, they report actually increased anxiety and depression levels. So I will drop in the chat as well our last year report, which is still very valid, and we still see similar impacts on persons with disabilities today within the COVID response. But sharing some of the initial practices and protective factors, we saw it's really important to work on first data on persons with disabilities, so to have stronger tools and methods for identification of needs, but as well the identification of some of the specific barriers and risks. And then to use that data for sure to adapt our targeting and on the intervention strategies. We saw the importance of upscaling actions around awareness raising of humanitarian actors on disability inclusion. So for example, giving short inputs into cluster meetings, producing tip sheets and sharing them with different humanitarian actors on accessible information, how to reach the persons with disabilities. So some of the actions we've done in Somalia and Syria and in South Sudan, among others, but as well to co-construct some of the specific protection messages for persons with disabilities we could share with staff and communities. So things we have done, for example, in Burkina Faso using radio messages, or in the Philippines using multimedia messages. And yeah, as a last point, and that will bring us to the vaccination strategy as well, it's really to work around accessibility of information. So centralizing resources for translation, alternative formats for communication, easy to read, sign language, and then to share those through networks of persons with disabilities. And I think it's really important to think about some of the reasonable accommodation options as well. So providing persons with disabilities themselves with phone credits, access to the network and the protective gear so they can directly reach out to their members. And yeah, happy to reply any questions afterwards and share more findings. Thanks, Christian.
Great, many thanks, Sian, for those great inputs. And definitely, you know, the big challenges that the sector still faces in terms of addressing the needs of persons with disabilities and the rights, but also the good pointers that you provided on what can be done in these circumstances. Thank you for that. So now I'm going to move to Gabriel. So Gabriel will speak in Spanish. So those of you who need translation, please feel free to go to the Zoom channel that you need. Gabriel, over to you now. Yeah, I think, Gabriel, you are on mute. You can unmute yourself. Okay, we seem to be having some challenges.
يبدو هناك مشكلة فنية. بعض التحديات نواجهها من جابرييل الذي يتحدث الإسبانية.
Okay, so mindful of the time, I suggest that we move to the next question to our panelists. And Gabriel, once the tech issue is sorted, maybe we can hear from you later. So the second question to our panelists is, what is the perspective on access to COVID vaccination for displaced persons with disabilities? And what are the anticipated challenges and measures to address them? So
Hola,
Gabriel.
Hola.
Okay, so we have Gabriel.
Ahora?
Yes.
Hello. I'm really sorry, I didn't have this audio activated. I can start again. I'm very sorry. I didn't actually see that I didn't activate my sound. Thank you very much. Good afternoon, all of you. My name is Gabriel Soto. I'm a director of the Latin American network. When we speak about refugees, and we are actually working together with this Latin American organization network. I would like to mention one of the stronger main points of our work when it comes to the situation with persons with disabilities and displaced persons in Latin America, whose results will be published officially in July this year. I'm going to just tell you what it will be published in July. I'm going to speak about the most important facts. In this regional report, we actually work with Venezuela, Colombia, Ecuador, Peru, Chile, Mexico, and also in America Central, Nicaragua, Costa Rica, Honduras, Guatemala, and El Salvador.
Well, when we began this investigation, the idea was to get center on the human mobility and having in mind the different countries in these situations, such as Venezuela, America Central, and Mexico. But there was the pandemic happened. There was an outbreak of the pandemic, and we had to add to our investigation also the topic of COVID-19. So what we have seen in general, the fellow colleagues have already spoken about that. We have seen that as well. But one of the topics that we already saw, and that happened with people with disability when it comes to the migration and pandemic, it happened also when with their income. People with disability had also the lack of income, and especially in the area of informal jobs. And the pandemic with the lockdowns, obligatory lockdowns, influenced that those people lose these source of income because those jobs were not existing anymore. So a lot of jobs were lost. So many people didn't have enough funds to cover their base expenses. So
they had to pay for their health insurance, for a social service. And actually that has a great impact when we speak about economy and social difficulties. And that also had influence, impact on persons with disabilities in countries which received them. when we speak about consequences in that sanitation aspect, a lot of persons with disabilities require rehabilitation, caring that it's necessary to have this permanent help and health care. Also, other aspects that are in this group of displaced persons with disabilities, it has to do with their mental health also, psychosocial help, because you know, the consequences are depression and other anxiety. For example, if someone is infected with COVID-19, the consequences of this disease are that you cannot have enough contact with people. Generally, in the countries, in the host countries,
a las poblaciones de personas con discapacidad en las respuestas humanitarias.
They have actually included persons with disabilities in this response to COVID-19. In some countries, on intergovernmental level, they have taken actions to in this humanitarian context. They managed to include them in their response. They also were able to receive food and some tickets to some cash money in order to pay some basic need for some basic needs, to meet some basic needs. And when we speak about economic help to meet basic needs in order to maintain themselves, to content themselves, social help, psychological help, support. Also, some orientations in this medical healthcare, also items of hygiene, also some online meetings in order how to guide themselves in this context.
Necesidades específicas de las personas con discapacidad se pudieron también tomar en cuenta esas situaciones materiales.
We have also been able to include some material which follows the data of necessary measures for the people with disabilities, and those were the measures which could diminish the effects of the pandemic. I don't want to say that all of the necessary answers and measures were taken, because unfortunately we are still in a situation of pandemic which put forward the situations of invisibility of these people with disability. Also, when it comes to the people who migrated and refugees and so on, and many times these people were put in situations of insecurity and when it comes to their development, when it comes to their host country, and they couldn't continue educating themselves or forming themselves, so they had to stop doing that in order to flee their countries. So I want to express right now the most general things the most general views that we have and that will be published officially in the next month. Thank you very much.
Muchísimas gracias, Gabriel, por tu intervención.
This is currently developing. I'm very mindful of the time. We don't have a lot more time left, but I would like to hear on the second question. So maybe we'll do it the other way round. So Gabriel, stay put, because I'll ask you first to respond to the question on what is the perspective on access to COVID vaccination for displaced persons with disabilities, and what are the anticipated challenges and measures to address them? Gabriel, if you can answer that, and then we'll move to Cien and Ricardo.
Bueno, con el tema.
Well, okay. When it comes to the vaccination, it's the constant topic in our organization and also in Latin America. Many times the difficulties help other difficulties. So it's very overrepresented, and not all of the countries have a vaccination system which is strong enough to support all of the people, that all of the people get vaccines. The big problem that we have today is that when certain persons are prioritized, which people with certain needs, during the pandemic, well, certain people are prioritized, but never people with disability are never taken in those measures. So there was very
los gobiernos han ido visibilizando el tema.
But the governments have actually put this, made this topic visible. And when we speak about organizations with people with disabilities and their families and themselves, they actually managed to make this important, to make it visible to them. And also this has presented a difficulty also.
Thank you very much, Gabriel, for that. And message that persons with disabilities definitely need to be prioritized in the vaccination process, but also we need to support how to overcome the challenges. Okay, can I move now then to Cien from Humanitarian Inclusion? And please, mute your mic so that we can hear her. Thank you. Cien, over to you.
Yeah, thanks, Christian. I will be quite quickly, not to repeat myself with the previous recommendations, but yeah, on my side, it's really needed to make adaptations to the vaccination strategy in every country and at regional and more local level.
Thank you, Cien. That's very clear. Ricardo?
Thank you, Christian. Maybe one quick message on amending legal frameworks. So UNHCR has been advocating for national strategies to include refugees. That would include as well refugees with disabilities, and to consider that refugees with disabilities face additional barriers to access social protection and health systems if the information is not made accessible again, right? But there are certain countries that have actually discriminatory provisions in the national law that prevent refugees with disabilities to access public health, social protection systems. The time is now to amend these national legal frameworks if we want to first ensure that everybody is protected, but as well that social protection systems will be ready to support persons with disabilities who are displaced, who are asylum seekers, refugees, to access recovery opportunities. Some of these measures will take time, but some immediate measures should be put in place. Thank you.
Thank you, Ricardo. The time is now indeed. So nothing else to add to that. Final words of yours were really what needs to happen. We have 2 minutes left, so we won't have time for the questions, unfortunately. But obviously, everybody, feel free to reach out to the Disability Reference Group with any questions that we can address to the rest of the panelists. But before closing, though, I'd like to give the floor to Emma from WHO on just a 2 minutes pitch on the vaccination process from your end, Emma, if you can.
Thank you, Christian, and thank you everyone for just giving me a little bit of time in this really important event. Being very brief, equitable access must be a guiding principle to all COVID-19 immunisation programs. In light of this, in April of this year, WHO and UNICEF actually launched a policy brief on disability considerations in COVID-19 vaccination. This brief provides guidance to a range of stakeholders, including governments, healthcare providers, and communities, which of course includes civil society organisations such as organisations of persons with disabilities. It provides guidance on appropriate actions to address the barriers that persons with disabilities face in accessing vaccination, ensuring that people with disabilities who meet criteria for vaccination can have can access it on an equal basis with others. It's important to note that this policy brief is actually a follow-up to earlier guidance produced by WHO in March of last year, 2020, which covers disability considerations for wider COVID-19 responses. It's really essential that all actions to prevent and contain the spread of the virus, such as mask use, physical distancing, that these continue and that these continue to be inclusive of people with disabilities, especially in these early phases of vaccination. When immunisation is not widespread. So we really encourage everyone to use both documents in your advocacy and program planning. Finally, we are in the process of translating the vaccination paper into different languages, and we are producing a short animated video explaining the messages in simplified formats. These will be available on the website in coming weeks. So I will put the links to these documents in the chat box. Just a big thank you to everyone, all the individuals and all the organisations that contributed to these initiatives and to this really important event today. Thank you.
Great, thank you very much, Emma. And yes, looking forward to look at the policy brief and subsequent documents. Thank you. So we are just on time, unfortunately not time for questions, but I want to thank once again all the speakers for your time, the captioners and the sponsors for this event. Please reach out to us, to the reference group at the email address that has been put on the chat box if you have any more questions or follow up on this event. Thanks again all for your availability and joining us today. Thank you.